Yes, hello. Today we are interviewing Serena Zucchi, psychologist and neurofeedback therapist. Hello, Serena.
Hello, good morning, everybody.
So we will be talking about communication aspects related to teenagers who suffer from obesity or other eating disorders, and also a few things. We will find a few things about orthorexia and microbiota in this interview. So for the very beginning, I would like to ask you something about communication, because we know communication is an essential component in providing healthcare for adolescent patients in all areas, including eating disorders and obesity. So, what are some tips that you consider essential in communicating with adolescent patients?
Yeah. Thank you, Anisoara, for start with this important question. Yes, you are absolutely right. Communication with adolescents is the bridge to create link between them and the environment, them and the adults, but then and the context in which they live. So, of course, to be very effective in communication with adolescents, it's very important to be very practical and to help them, first of all, to improve the capacity of reflection and to have an introspective point of view about the aspect of their life, emotions, behavior. We know that sometimes adolescents are very active and transform in behavior, they inner troubles, but it's also very important with them to be very practical and concrete, giving them some tips that feel themselves comfortable and active in management their inner world. So with my patients, I used to work with adolescents in a center for psychotherapy for adolescents and young adults. And I used to do many practical exercise with a grounding technique to help them to be more connected to the environment, to themselves, or also breathing technique to improve the capacity of become calm and to be more locus of control, inner locus of control.
I see. And I suppose you also try to involve them in communication and to help them make some motivational changes, right? How do you involve them in communication?
Involving them in these techniques, I used to call them anti-stress technique. They feel more active and proactive, and this is a very good link with them. And so to improve the motivational change is very important for us as carers to be very connected to their needs, and so to be timely in our intervention and to be very synchronized to their needs, offering them this very also practical solution that is very important. It's not the solution of the problems, but it's a way to stay together on the process in finding the solution, and they will find their own solution.
Good, very interesting. And in this process, would you also involve their parents when discussing, for example, with an adolescent with obesity, or would you just talk to himself or herself? What do you think is best?
Yeah. Yes, of course, it's very important to involve the family and involve the parents. Now we know that exactly as the driving behavior is influenced by the parental driving style, so it's the eating style inside the family. So the eating style of the adolescence is very influenced by the parental eating. And now we know also that this starts even in the perinatal period, so at the very, very early stage before they was born. And this is a reason for which it's important to involve the family to reflect about the habits inside the family. But also it's important to involve the family and the parents, because now we know that sometimes the emotional dynamic inside the family are and remain implicit.
Mm-hmm.
And this circulation of implicit emotions and behavior could be expressed in the food, in the way to eat, with control, for instance, especially by the parents, or with the angry or reaction of positive behavior by the sons, the daughters. And so this is a very important reason in which a family therapy, especially with eating disorders, is very recommended to include in the process all the members and transform these different levels of problem in something more approachable.
Okay, very interesting. Good. And how would you define motivational interviewing, and if there are stages into it?
Yeah, well, we use this model that it's the trans-theoretical model of Prochaska and Di Clemente, that it's a very interesting model that we used to introduce in a health promotion project and health promotion activities, but that could be also very helpful in the clinic activity with patients with different kind of disturbances. And of course, also with eating disorders, the trans-theoretical model could be interesting. It is it describes 5 different phases. And these 5 phases correspond to the motivational attitude of the patient. The first phase is the one that is defined pre-contemplation phase, and the pre-contemplation phase, it's the moment in which the person involved is not very conscious about the problem. Yes, maybe she or he knows something about something in his life, her life, but that is not really a problem. So if we are in a pre-contemplation phase, it's very, very difficult to approach the person because there's not a need. So we have to prepare exactly this aware to read some signs and give different meaning to these signs and to improve the need to do something about these signs. Okay, and it's also very interesting, especially in the family, because sometimes this phase is not in contemporary in percept by all the members of the family. Sometimes parents could be in the further stage, the contemplation phase, the second phase, but adolescents could be not so in advance, and so they could be in the pre-contemplation phase. And so it's very, very important also to synchronize this phase before to proceed in and intervene altogether. Okay.
Mhm.
So the second phase, as I anticipated just now, it's the contemplation phase, and in this moment, the person seriously is think about making something, even if he or she doesn't really know how to act on that. And so this is a very important moment in which the health worker can help and can support, maybe with psycho-educational information, preparing and giving and improving health literacy. We know that health literacy is something concerned that is connected to the knowledge about the disease, about the problem, but it's also something that it's linked, and it's about how to manage the problem of health and how to contact the specific point and the specific person that can help to manage the problem. And then there's the third phase, that is the preparation. Preparation phase is something in which the client prepares himself for taking action. So it's something to prepare the environment, to change maybe some routine, to create some routine that could be very helpful, because they can substitute previous non-function routine. And then there's the action stage, finally the action stage, in which the adolescents start to prove these tips, issues, and aspects that had prepared in the previous phases, arriving until the final stage, that is the maintenance stage, in which we work with the person to avoid relapse and to maintain their health as they reach.
Mhm.
Yeah.
Okay. Yes. And of course, advice, this kind of advice that you already spoke about is transmitted to adolescents, to teenagers who suffer from these disorders by specialists, by healthcare staff, and to them and to their parents. So what do you think that should parents and healthcare staff be aware of when communicating with adolescents with obesity and eating disorders?
In my experience, it's very important to maintain empathy. Empathy means to stay in active listening and stay on the real need of the patient. And it's very important not to judge, of course, to use positive language. It's very important choosing right words, positive words, to improve resilience. Mm-hmm. Sorry for that. Mm-hmm. And because sometimes using this positive attitude and empathic attitude, we can teach to the person to use similar attitude towards themselves, because we know that the first judgment is the one that the person had towards himself or herself. So the shame is one of the worst feeling that they can feel. And if you said to them, "Okay, you don't have to have shame doesn't work. It's not the correct approach. The approach is to maintain an open approach, inquiring the reason. There's always a reason. There's always a why. If you feel like that, if you feel shame, just a why. Let's investigate where this feeling was born, in which occasion and why. That was the best solution that you can improve in that situation. So that approach that I would like to call curiosity. This approach could be a good approach. Curiosity, it's something that is opposite to judgment and a negative approach. Yeah.
Mm-hmm.
So I would recommend this kind of approach to improve the modeling and to improve this empathy. And that we know, because we know that mirroring neurons are very active in adolescence, and they can learn very, very fast through them.
So empathy is the key to opening unknown doors. Young people, we know, some young people are very careful to healthy eating. Some of them even to the degree of developing an eating disorder, which is called orthorexia. Can you tell a few things about orthorexia?
Yes, of course. Thank you for asking. This is a very recent phenomenon that we can observe in adolescents and also in teenagers. And we know that it improves a lot, especially after coronavirus period pandemic. Orthorexia is not included in DSM-5 by now. It's quite a recent manifestation of eating disorders. And it's something that has a positive matrix because it's an attention to healthy food. Now we know that adolescents are very keen on healthy food for ethical issues and reasons connected to the environment and sustainability, but also for reasons connected to health and to maintain their health. Orthorexia is something more. Is something that exceeds this caring and becomes to be dangerous for their own health. Is to be maniac and with obsession of the caring of a healthy food. So this is something that we have to monitoring in this phase, because it's something that, as we know, adolescents sometimes are very exaggerated. And the important approach in this case is, again, to stay on the process, to reflect, to discuss with them, and to follow the flow of this current. Yeah.
Okay, good. And somehow related to this is another question about the relationship between microbiota and diet. Can this be harmful? How can this become a harmful relationship?
Well, this is a very new and, well, not really new, but it's new in the clinic. It's not very new in research, because microbiota is something that researchers started to work and to study more than 10 or 15 years ago, even if the beginner of this researcher were a sort of visionary, because they started to discover something that that was very new 10 or 15 years ago. And now it's something new in the clinical practice, of course, because these researches are becoming stronger, and now we are starting to have evidence on the impact on the caring, on the healing of the person. So microbiota is constituted by the microorganism inside our intestine. intestinal, and the many factors can influence it. Factors could be inner factors like inflammation, or also external factors like environment. Of course, food and the quality of the food that we have has got a lot of influence on that. And we know that if the microbiota is constituted by cytokines, inflammative cytokines, then they can escape from the intestine by crossing the intestinal vascular barrier, and they can penetrate in the blood-brain barrier, so influencing the constitution of neurotransmitters. And neurotransmitters are the base of many pathology, included also anxiety and depression, and including also eating disorders. Or now the interesting thing is that sometimes this inflammation in microbiota has got some symptoms that we can observe in our belly, in movement in the belly, in
Bloating, maybe, no? Bloating.
Bloating, exactly, thank you. In bloating, and we can confuse this bloating with something that could be obesity or fat, and teenager can start to have a very low fat diet, as for instance, assuming only vegetables, only salad, but the salad and only vegetable can improve the bloating, and so it is something that could be only worse. So it's very important to have care about the microbiota, to monitoring also microbiota, and in the very early stage not to confuse this bloating, this inflammation in something that is not eating disorder, but is something that we can maybe just care with some antibiotics and changing the diet and maintaining physical activities, and something that can re-enter in a very short time.
Okay, thank you so much. This was a very interesting interview. Thank you so much for your time, and good luck with your activity. Thank you.
Thank you to you.